Like the first item on the agenda is to welcome Jennifer Hadlick and Alyssa McKenzie. Jennifer, I see you, and Alyssa,
Hi.
there you are.
Hello.
Hi, welcome.
Thank you.
Thank you.
I'm sorry we didn't have the opportunity to meet you two in person, but this is such the way in the life of the COVID era. But anyway, it's great to have you here. I'll just give a little bit of a background on Jennifer and Alyssa. Jennifer Laddick was, she's actually went to high school at Westminster in Connecticut, up in Simsbury, attended Barnard College, and was graduate from the University of California, Berkeley with a major in history and minor in education. A little bit of Jennifer's background. Presently, she's involved with the Carriage Barn Arts Center. In San Francisco, she was involved with the Larkin Street Youth Services, where she's Director of Education and Employment and an Education Program Manager prior to that. He worked with the homeless, the runaway youth, partnered with case managers, social services, medical care providers. And earlier again in San Francisco, she was involved with the SCORE Education Centers, where she was a director, and involved with tutoring services, education, managed staff, etc. And recent volunteer activities in New Canaan, there are many, but primarily with SACS, ABC, New Canaan High School. It's very impressive, Jennifer. It's great to have you part of the commission.
I'm happy to be here.
Welcome, Jen.
Yeah.
Welcome.
Okay.
Happy to have
Welcome.
Meet you Zoom-wise.
and next, and we're just doing this in the order of, or alphabetically. So Alyssa McKenzie. Alyssa went to New Canaan High, so it's good to have a local product here. Was graduated from Boston University, magna cum laude. That's impressive. She has worked with as a youth disabilities instructor at the Y locally. Alyssa is also a freelance writer. She's dealing with many issues, including chronic illness. She's the founder and editor-in-chief of Made Lemonade with Lupus, has been somewhat of a political consultant and volunteer in many activities locally too. So Alyssa, it is great to have you here. It's an impressive CV. And just to, go over what we do at the Health and Human Services, it's our job to really we serve as an oversight. We make suggestions, contributions in terms of maintaining everyone in town with and perceiving the health care needs, the needs of shelter, food, safety, etc. So, and it's a very rewarding commission to be involved with, and we're very happy that you're part of it now. Any comments or questions, Jen or Alyssa, that you'd like to add?
Just happy to be here and excited to start to learn about what you guys do.
Exactly. I'm looking forward to getting to work.
It's great. Happy to have you here. The next item is the approval of the minutes. So you all
I'll make a motion to move.
copies of the
Approve.
Second.
all those in favor?
Yo.
Okay, approved. Reports. Jen Eielson, and Jen is the director of the health department.
Sorry. Well, good morning and welcome aboard, Jen and Alyssa. Thank you for joining us. So just a quick update. I do have to jump actually for a state call at 9:15. So I'll just give you a rundown. We had a few more cases this week. There's really no clear link, unlike last week where we kind of had more clear link. So that's kind of indicating community transmission is back and a little bit on the rise, which is kind of expected after, 2 weeks after Labor Day, the schools are back in session, all the sports are playing, people are, I think, getting a little lax. So it was to be expected. We are working through it. I, work with the school system every single day, including the private schools. So we are able to mitigate it, unlike an area of town, you see where they're closing schools right and left. That's because they're not doing the contact tracing on weekends that, myself and Dr. Lutzi and Janet pride ourselves on in order to keep the schools open, but keep them safely and isolate people as, as needed. Some other quick updates. I have another different state call this afternoon about the COVID vaccination updates and moving forward with our strike team plans of vaccinating our critical workforce. Critical workforce is described so far as public health, police, fire, EMS, and potentially the teachers and school system staff. So depending on the doses we're allocated is depending on, what model we're going through, but most likely it'll be with strike teams. We also right now, because of all the real estate transactions, we're kind of being inundated with all, the septic, with the soil testing, septic inspections for the old systems, new additions, things of that matter. And we're also getting a lot more complaints. Chris is fielding a lot of complaints about, incorrect mask wearing, both in establishments that we manage, which are the salons, the daycares, the restaurants, and then of course, just out and about in the public. And I think there's also still a misperception about when you have to wear a mask, when you don't have to wear a mask. We've kind of designated Elm Street as a mask required zone. Last Friday, myself and Chief of Police Leon, Tucker, and Kevin were down there, just trying to get people to be aware and hand out masks. You are required to wear a mask downtown. You can't really socially distance. But if you're in Waveney Park walking your dog and you're by yourself or, with your husband, you're not required to wear a mask. So I think it gets a little dicey. So we have to work through that with all the phone calls, but, we're happy to do that. And as far as like the restaurants, reminding them that, you have to wear them, you have to wear them, correctly. And, there is that fine or by the governor, but there really has been no mechanism put in place of how to actually, go forward with that. So there is no health department currently fining anybody because again, they didn't develop the mechanism at the state level. So we're just going to continue to work through and do what we have to do. And as the cases, continue to rise, mitigate them as they come along. So hopefully we don't have what we had in March, April, May. So any questions?
Yeah, have there been any cases in the elementary schools, the schools?
Not from the elementary school. There have been, cases that because of family members or whatever have tested positive. So they're quarantined, but not from transmission in the schools. We did have, in the high school, but that was more linked to sports. But I mean, and with the high school, that actually worked out perfectly because they're still in the hybrid model. So we had the 6 feet to the most desks, and we had, the teachers, seating charts. So, on a Sunday when we're working through it all, we were able to pluck out, okay, this one needs to go, this one needs to go. And what people don't understand is, those people then have to be monitored and, you can't test out of quarantine. If you're a direct contact, meaning you were within 6 feet for 15 minutes or more, you're told by me that you need to quarantine, you cannot test out of that. You need to quarantine for 14 days. It's not like the travel advisory. So you can get tested just so you know, and then we could contact trace on that.
Jen, did we have a
Someone, what happened?
Yeah, is the sound okay?
Harrison,
mine is now, but I've been going in and out.
There you go. Okay, you're back on.
I'm going to try to change though, because Jen, was there a nursery school child that tested positive?
again, it's not from the nursery school. So You know, you're going to have that of cases of testing positive, and then you find out where they go and you isolate them. But it's not like the transmission occurred in the nursery school. So I think there's a clear distinction to make there. So.
Yeah, correct. It's just always the potential if you have a positive. Okay, that's great. Thank you, Jen. Anything else? You know, I was thinking that maybe an oversight, that maybe we should introduce ourselves briefly to Jen and Alyssa, just to, and I'll start it off in just a sentence or two and just tell them your connect. Are you able? I'm going to change my locus because this isn't working. Can you be? Shh.
Hi, I'm Larry Smith from Connecticut Basement Systems.
I'm in here. It's terrible.
Thanks, everybody. We'll get back on track.
Okay, I'm sorry about that. We've had some workers at the house, so I went to this remote area, so there wouldn't be any background noise and lost you. So I'm back where I think it'll function a little bit better. Anyway, my maybe a little bit of an oversight, as I said. Maybe we should just go around the table, introduce ourselves briefly and our connection with HHS. I'll start it off. I'm Harrison Pierce. I was a pediatrician in New Canaan. Still, I'm a pediatrician. Worked with New Canaan medical groups. Did retire a few years ago, 3+. Presently, I'm a medical advisor and just continued with that to the public schools, New Canaan Country School, St. Aloysius. And I'm involved with the Emergency Operations Center. Thank you to our first selectman, Kevin Moynihan, et cetera. And have enjoyed being part of Health and Human Services for the last couple of years. Just go around the table, just brief introduction like that, and then so Jen and Alyssa have a better idea who the rest of us are.
Okay. Hi, this is Tom Ferguson. I don't know if I'm where I am on the table. I've been on the commission for about 15 years, a long time. And it's great to see some new faces and some people in different generations. So that is terrific. When I was working, I was a consultant in the healthcare field as in employee benefits, and I'm an actuary by profession. In the last 15 years or so, I've been very involved in staying put in New Canaan on the board there, and also at the Waveney Care Network. Of course, working with Russ and a lot of other people there for quite a few years as well. And I've got a multi-generational family with a son and 4 grandkids in town, including 3 at the elementary, 2 at elementary and 1 at SAC. So anyway, nice to be here and nice to welcome you aboard.
Tom, even though it says Karen, are you still in Sicily?
Yeah, I live in Sicily now. In fact, I spent my entire life in front of that Greek temple in Sicily. And I'll change my name.
I'll try to follow that. Russ Barksdale, welcome, Jennifer and Alyssa. It's nice that I'm no longer the youngest member of the commission. That was a joke, but in any event, I'm president CEO of Waveney Life Care Network and its full continuum of care. I've been on the commission now going on a year, so welcome again. and thank you for your willingness to join. My background, 35 years in healthcare, hospital administration, and love post-acute care, love New Canaan. I also serve on the EOC along with Harrison and Jen and Bethany. So welcome both of you, and we appreciate your time and your willingness to serve. Thanks.
My name's Bethany Zaro. Jen and Alyssa, welcome. I'm the Director for Health and Human Services. Sorry about that. And so I just took the position. I've been working with the town for 12 years, and I'm a resident of New Canaan, but I just took the position in July 1st as director and acting as interim for 6 months as well. So welcome, and we'll be working together, and I look forward to your input. Thank you.
Jim, you got to unmute yourself, Jim.
Okay, how's that? We go from Russ being the youngest to actually I'm even older on the commission than Ferguson. Basically been on for at least 15 or 16 years, involved heavily with seniors activities, but also I was chairman for 10 or 12 years, and the father of the telehealth group, and now, as you're going to hear, the telemental program that's coming up. I spent 30 years as a management consultant in the innovation strategy business for large companies, and have been in New Canaan for 35 years. So I like the place, and I love being a part of Health and Human Services, as I'm sure you two will also be. Thank you.
Okay, I'll go. Lance Minor. I've been on the commission, I think, since 2000. And I left my big job at Sports Illustrated many years ago to get my wife sober, and went out to Minnesota for 1 year. Became an alcohol and drug counselor, came back here, and that's what I've been doing as an alcohol and drug counselor. So my main motive in life is to help people get sober and alcohol awareness. And I'm on the RAM Council with Joyce and have been for 20 years with her. And that's my mission. And also we're going to hopefully, with your permission, run 4 more ads in December. The life you save may be your own. So that's my main mission, is alcohol awareness. And especially with what's going on in the world today, it's the #1 job. Thanks.
I'll go next. I know Jen and Alyssa, so I'm Alicia Meyer. I'm on the Youth and Family Services Subcommittee. I was a litigator. I've been a stay-at-home mom. I've been involved in everything here in town for kids. I'm on the board of ABC House, volunteered on the board at West School, St. Luke's, teach Sunday school at the Congregational Church, Girl Scout leader, all the things. So anyway, looking forward to working with you guys.
I'm not sure where I am in the order, but can you hear me? Because I keep getting an alert that says my internet's unstable. But I'm Marcy Rand, and I'm the Adult and Senior Services Coordinator here for Human Services. And started in July. So I am almost new to you guys. So welcome, and I look forward to working with you.
And I guess I'm last. Did we get everyone? I didn't want to jump in. I'm Jackie DeLuey. I'm the Youth and Family Services Coordinator for the town. And actually, I could prove that Tom and Jim have been around 15 years because I'm coming up on my 15th year with the town on December 15th. And I remember both of them from probably my first commission meeting. So it's great to have you both joining us. I was listening to your backgrounds, and I think there's a lot of great things you can help us with here in town. Obviously, if you have things that you want to work on, we'd be happy to help with that as well. But we can explain what we do. But like I think in counting, Bethany and I were pulling together numbers. I think I'm case managing about over 60 families I think that's, she has the exact numbers, but it's over like 120 kids in those families. Most of them use our food pantry, and they have needs every month from, obviously COVID presented a huge, issue for a lot of our families, with not being able to work and then the hybrid with the schools. So you can only imagine, what that brings. So happy. Also, I co-chair our it's actually our New Canaan Abuse Prevention Partnership. So if either of you have any interest in that and you want to attend those meetings, they're Zoom at this point. But please let me know. And I'm sure there's a lot of other stuff. So happy to have you both. Thank you.
Thank you all. So the structure of the town is there's a health department and there's a human services department. And we are the commission with oversight of both departments, so health and human services. And our goal was to balance the commission somewhat. And as Tom alluded to, we moved it down to the next generation, and there was a little male bias. So now we're equaling the numbers to give Alicia a little company. And thank you, Alicia, for the minutes again. Next item on the agenda, Human Services Department, Bethany.
Okay, I'm going to start with the food pantry. The numbers remain constant at about approximately 40 to 45 families coming in for each distribution day, which is every 2 weeks. And we distributed the second round of New Canaan Farmers Market vouchers, so that they're using this month until I think the second Saturday in October. That would be the expiration date of these vouchers. And our next food pantry, which is October 6th, that was going to be a walk-in distribution. So we're working with St. Mark's and creating a COVID environment, safe environment, or decreasing transmission possibility. Next, flu clinics. I have scheduled 4 flu clinics on the 7th and 9th. I'm doing Lapham Community Center. We did a sign-up list, online reservations. I have 100 high dose, I'm sorry, that is filled up. The reservations are filled. I do have probably about 30 regular doses still to sign up for, so that's a possibility. This was given to people 55 years and older. So that is going well in terms of the signups, and Aggie's doing a great job of keeping that organized over at the Lapham Center. And we will set that up the way COVID testing has been done. And so I walked through with Aggie last week, and we're all set to go there. They have screens, and everything is going to be done as contact-free as possible, only with the shot and filling out the form. And let me see, community outreach team. This is a team that I started during when COVID started, and each agency, organization that's focused on seniors or helps seniors. We have about 70 on the email blast. I sent out a email this week and letting everybody know that Human Services is concerned about the seriousness of this winter with the shorter days, colder days, longer days, colder days, longer nights, that's what I'm trying to say. And so Marcy, the senior outreach worker, and we are doing individual outreach. We've started that with the community outreach team, talking to each liaison for each agency or membership. And we want to, keep informed with them, as well as we're going monthly through the COVID of our vulnerable population list that we've acquired, which is about 120 people. So we're keeping in touch with everybody and starting to gear up for the next season as we have to stay indoors more. So we're conscious of the seniors and the potential for isolation, depression, anxiety, stress, all those behavioral health issues. And we are also drawing up an email or a letter to send to the medical practices in town. So letting them know that Human Services is here to help from family, youth, and adult senior level, just so they know that we are here, and we will give them some of our cards and just do more of an outreach. Let me see, holidays. The holiday, Marcy and Jackie and I spoke, and it's going to be different this year. The seniors, we are going to do Christmas bags, which National Charity League is donating. And with box of cookies, we're not going to do the poinsettias this year. And we're just going to do a contact-free. Yep.
Did we just move that down to it's under new business, the holiday programs?
Oh, you're doing that? Okay. So that it
I mean,
has
you can talk about it there, okay.
All right, I'll skip then to Get About, which I am the ex officio on the board of Get About. I attend their meetings each month. The rides are up, and as they slowly increase, they are going to. There was a suggestion possibly trying to move because they were having trouble with their Optimum and trying to use their computers, as well as having access to plumbing, to bathrooms, but that's all been taken care of, and they are going to stay where they are by the train station. So that was done. The next thing I want to show you is, let me see if this works. I'm going to share the screen. Can everybody see that?
No.
Not yet.
I'm wondering if, when Pam handed it over to me, okay, well, I have a spreadsheet that I'm wondering when Pam handed it over, I think. So the spreadsheet, I'm going to give you some numbers. The clients served, as Jackie was saying, I've done July, August, and September. I will send you this attachment, everybody. I apologize, it's not on. But for July, August, and September, I've blocked it into a quarter now, and I will send you each separate month will be shown as well. But a total for the first quarter, Jackie has served 88 families, 88 adults and 427 children, which is approximately 63 households she has worked with for the first quarter of the fiscal year. Marcy has worked with 401 individuals. She started out July working with 100. It moved up to 140 in August, and then September she is working with 160 individuals. So one of our goals was to increase our outreach and contact with the seniors, and this is definitely happening. Our phone activities for the first quarter has totaled 2,008 phone calls, roughly around 650 to 700 phone calls each month, which is up from previous, not the COVID quarter, but last time this year. Our year-round programs, we just started doing LAPM activities with Marcy, and she's up to 3 classes now, a total of 66 seniors that she's in touch with. The food pantry individuals, we have served 599 individuals this quarter, which works out to 242 shoppers shopping for 599 individuals. This is family related. We've done over 90 home visits for the quarter to the immobile, homebound, and this had a lot to do with tropical storm that occurred. We did go out when we could not get in touch with some of the homebound. And our telehealth data input for the quarter, I have had 500 inputs in terms of people giving me their vital signs and Fitbit stats. So the renters rebate program this year, we did totaled renters rebate ended today, October 1st, and we did a total of 54 seniors or disabled residents, totaling, they will be receiving checks probably in November, December, for a total of $23,900. So thank you, Marcy. And Jackie, I think Jackie did a renter's rebate as well. Food pantry, farmer's market voucher, the first round that we did in July, $4,100 of vouchers were used at the food farmer's market, and that totaled 61 clients, 61 shoppers. And so that was excellent. We've started another round, which I've told you, and they will be going to until the mid-October, and we will see what those vouchers are at the next meeting. I'll be able to tell you. Back to school program started in August. We serviced 45 families, which was 87 children. And then there was a state program, the Senior Farmers Market Program, and we gave out $18 worth of farmers market vouchers, which could be used at any farmers market in the state. And we received 22 of those voucher packs, and we've given them all out. So I'm going to send you, I've got a lot of financial categories that I've put down. The bottom line is, for the quarter, we have given out $11,950 in financial assistance. It's been broken down that $5,700 has been given to the Human Services General Assistance Fund, which is our line item. Touch of Life has given $1,260, and Salvation Army has given $5,004. So we have a total of $11,957 that we have given out this quarter. The total remaining for our $22,000 general assistance line item for human services, we have $16,307 left. Remaining, which works out well per quarter. I think we're gauging it well to get us through till the end of this fiscal year. And then the food pantry, we have $49,000 in donations that are still standing there. So we're making great headway with donations, as well as still purchasing the food items that we need to feed those in need in the community. So I'm going to try to get this. I definitely will send this all to you. I'm sorry for all the numbers. Yeah, I thought I had the host handed over to me, and I should have, but it's not. I'm unable to share. So,
Bethany, question.
Yep.
Now, we've got a stronger staff in both numbers and talent level. How are we sufficiently staffed now to meet the needs of our community and the calls we're getting and so
yes.
forth? How are we doing in that regard?
We're doing great. I want to thank the staff. I mean, Marcy and Jackie as caseworkers. I mean, what we've done also, we've streamlined the department. We really have brought back an organizational level to the job descriptions and delineations that were written up for who does what. And that has really streamlined things. So Enza is really doing admin, getting everybody set up for renter's rebate and energy assistance. And then we've got really case management is done by Jackie and by Marcy, and they're doing an unbelievable job. I mean, I feel like we've got a great team effort going here. So with that being said, streamlining and the organization, we're much more efficient and effective. So yeah, we are handling a lot of cases, but it is at this point, it's doable and it's effective, and people are, we are getting them in touch with resources. Jackie was unbelievable. We had a domestic violence issue, and then the perpetrator was in the hospital on evaluation, but Jackie was, speaking to the victim and everything. She did an unbelievable job. Marcy, we had a homeless person. The police were trying to get help. They've contacted us. And Marcy did an unbelievable job with Enza yesterday, trying to help this woman. The Congregational Church entered in. I'm seeing the collaboration, the police. So we're really, I'm so pleased at how everything in the outreach and the partnering is happening, and we're able to take these issues on, as well as doing our daily casework as well.
Bethany, you should be able to share. You should be able to share now.
Oh, okay. Let me try.
And Bethany, great numbers, and thanks for you and your team. I mean, these are fantastic quarterly numbers. The only question I had was on the flu vaccines.
Yes.
Do you think we're going to need to order another round?
Okay.
Yeah, with only 100 high dose and 30, regular doses left remaining. Can we order a second round? And the second is, do we give priority at all to anyone, or is our process that here's our dates, this is how many we have, and on a first come, first
Okay,
served?
so, right, good question. So I ordered this vaccine pre-COVID, and I only ordered the amount that we do the year before, plus a little bit more. So then COVID came, and I'm on a wait list to receive 100 more high dose and 100 more regular. They're both quadrivalent. 4 strains are in them this year. That being said, so we gave, obviously the high dose is for 65 and older. I've also spoken with CVS and Walgreens, and they, if we do need to do, if the demand is there, both pharmacies have supplies, and they will set up, either one will set up at Lapham Center a flu clinic for us. We will do exactly what we've done, putting the sign up Genius, and people can do it right now. You know, yeah, with the high dose, people seem to be going and getting their high dose at Walgreens and CVS, although I believe they are out now. And there's Greaves in Darien right now does have high dose, but the local pharmacies were expecting more to come in. But I do have a backup. If I don't get, the problem is I'll probably get this in November or December, then we need this extra. So Russ, don't know what to tell you, but we've got a backup, and
Well,
the
that's
employee-
great. I hope it gets in time. You know, most places, as you know, are ordering a lot more this year. Just
Yeah.
you know, just been highlighted, and I think you'll find more and more people are wanting the high dose, especially the over 65-year-old group. So it's great that we have a backup plan, but because I just think that it's going to, you know, as time goes by, you're going to get more and more calls asking for that service.
Yeah,
So,
and we are, and we're sending them to places that we can get to, that they can get to. But I also tell them, you know, I take their name and number, and hopefully, I'm still trying to work with this. Enza, can you come here? So let's keep going, and I'm going to get this up for you guys for the next one. So that is,
Bethany,
yeah.
yeah, thank you for a very thorough budget report, and we will look at it when we see it.
I know, I'm so sorry. I'm going to
No
get
problem,
Enza to work
no
on
problem.
this. Okay,
But
thanks.
it's great to hear that Human Services is functioning the way they are. I think all the positions are filled. Marcy joining was a big factor, and so everyone is able to do what they were supposed to do with adequate time and numbers, et cetera. So that's happy to hear it.
Yeah, I'm just grateful for the team. It's been great, and the commission's been very supportive. Everyone's been supportive, so I appreciate it, and it's going to make a difference in the community.
well, let's thank Kevin too. You know,
Absolutely.
Here, here.
Thank you, Kevin. Next item, Adult and Senior Services. Marcy, as an aside, and I see that Mr. Dinan's along with us this morning, I did mention it to John Kovach about possibly interviewing you, and just for publicity's sake, so the town is aware of your presence here.
Oh.
I don't know if he's contacted you or not, but it may be coming.
Okay.
All right, you're
Great.
on.
Well, I will, I'll keep this brief. I know that Bethany mentioned a couple numbers that we've been working on. I finished up the renters rebate program. We did in fact serve 54 residents. That it ended today, and we started up energy assistance last week. That will go on for a couple months, and I am currently completing a Medicare Choices training program. The last one is next week, and then I will be testing for the Medicare Choices Counselor certification, and open enrollment starts October 15th. Our LAPM programs are going really well. I have another one in 2 weeks. They've been a lot of fun, and it's been great to get to know some of the seniors that I haven't met in person, but it's been fun meeting them over Zoom. We're continuing home visits. And as Bethany said, we are also continuing our calls to the vulnerable population list, just to check in about once a month or every 3 weeks, just to make sure that they have everything they need, and you know, they're safe and they're healthy. And that is it in a nutshell.
Thank you. Thank you. Next, Youth and Family Services, Jackie.
Yes, hi everyone. So, as Marcy said, we're starting fuel assistance. So I'm helping any families that have kids that need fuel assistance applications. They're trickling in. We're trying to make it as COVID safe as we can. If they can drop off paperwork or scan it, we can input it, get signatures, and then, not have them in the office. As long for both of, their safety and ours. As I think Jen pointed out, I've seen a lot of people come in with their masks falling off the nose. So obviously that's not the best use for the mask. So, of course we want to, make it as safe for everybody. But it's been great. I think it's really good to kind of help people with this. It's a huge need, and it will be an even bigger need for the families. Also, we've been working with, not to give too many details because I don't want this in the news, but like there's been some tricky cases in town, and if we're not directly involved with the family, we've kind of heard from, there's been some kids that have been removed from homes. There's been some other arrests in town that have affected kids. So that's been a little tricky this week with trying to help, kind of navigate for those families. But in good news, we have a new teen talk counselor. So I was thinking I should probably invite her to join us at a subsequent meeting. Her name is Grace Burke. She's actually a graduate of New Canaan High School, which is amazing. I mean, if ever anyone knew Emma Kate Friedman, she was terrific. And I thought, oh God, we'll never be able to fill these shoes. She went on to work for Silver Hill. So she's still in the community, but then Grace literally came out of nowhere. She was working at a school in California, and then with COVID happening, she ended up relocating back here with her family, and she is terrific. I think you will all see exactly what I'm talking about. Her and I have already consulted on some families that she's dealing with. She's, hit the ground running at New Canaan High, and really what's been helpful is she knows a lot of the administrators and teachers, being a graduate. So that has been phenomenal. So I'm really excited. Hopefully you let me know, and I'll have her, sign on and say hello to you guys. Because if anyone doesn't, I think the new people added to the commission, Jen and Alyssa, the town pays for that position in our I forget what the budget money is called, but we pay for that position to have her at the high school. So just would be great for us to meet her. I'm sure there's more things that I can talk about, but we have other meetings, so I'll leave it with that. If anyone has any questions for me, feel free to get in touch with me at any point.
Jackie, what is Grace's background?
I think you either have to have a social work degree or like an LPC. So I'm forgetting exactly what her degree is, but I think she's an MSW. So she's not licensed yet, but I think she's an MSW. Now I'm remembering from an email.
And is there anything planned for her to address the youth with the talks or whatever? Is that in the offing?
Well, no, her position is just to staff the school. And so kids that, probably more likely she's meeting with the kids that have guidance counselors, and maybe there's an issue at home, or, there were quite a bit of kids last year that had issues. So she has picked up those cases, but then, and obviously COVID has, created a lot of, anxieties or depression for kids. So she can check in. I think usually somebody will either suggest that she meets with the kid, or a kid could reach out to her directly. She also is interested in doing groups, providing what's going to be allowed with COVID right now. But, that's something that she's interested as well.
Okay, thank you. Next item on the agenda, commission. This is an opportunity just for any commission members to introduce anything that they think needs discussion, or their perceptions about town, or any new offings that we can think about or act on.
Well, I did want to thank Kevin again. I mean it sincerely for finding budgetary dollars for the additional positions in town. So again, thank you, Kevin, for that. I'll just remind the committee, we're still, Waveney Life Care Network is still COVID-free, both from its patients, residents, and its staff members. But the state and the federal government have mandated now that visitation be moved indoors. So we are starting and setting up 2 negative pressure rooms at 3 Farm Road. More to come on that. I know we had talked about O2 tanks and things of that, making that available to the outdoor community. I know EOC and Bethany, we're going to get together to figure that out. I just need to know what type of adapters that Waveney needs to purchase to make sure that we have enough oxygen during another emergency, that we can supply oxygen to the town and those very vulnerable populations. So thank you.
Right.
Thank you, Russell.
I had a
Next up-
question for Jen, but maybe Kevin can answer. I have 2 questions. One is about Halloween. Is there going to be guidance soon on is trick-or-treating going forward if our numbers can stay where they are? What guidance for Halloween? And then also testing going forward, heading into winter with the kids in school. What are the town's plans for testing, if any?
Halloween it's probably not, you're still on, Kevin, probably not going to happen, but I don't think a definitive decision has been made. Secondly, in terms of testing, that is on the EOC list of things to do. Everyone's wrestling with it, not only with the different types of tests, but who will do it. Physician groups have problems with it, and towns are looking at it. So yes, and especially when you get the intermix of the flu and all the other respiratory viruses. I did speak to Dr. Nair yesterday. She was the head of pathology at Norwalk Hospital, and she no longer is. And with the new van system, there's a new overall head of pathology and out of Vassar Hospital. But whether would be feasible for Norwalk Hospital or Stanford Hospital, whichever hospital, to have something in town that could actually do the testing for all of these things: COVID, flu, type A, type B, and the other respiratory viruses all present with very similar symptoms. And it would ease the burden on everyone in town, the physician groups, the schools, et cetera. If that happens, I'm not sure, but it's on the agenda of the EOC.
Harrison, I would just add that we expect the state to give guidance on Halloween, and the CDC has recommended no trick or treating, but the state will tell us perhaps more definitively. Then people are looking to do alternative Halloween kind of events.
Thank you. Old business, telemental project, Jim.
Hopefully everybody has seen this in their
Yes.
email, along with a quick video that will give you some flavor of introduction and a sense of what the first program is going to look like. For Jen and Alyssa, basically, this program started as a competition or a way that the town of New Canaan could compete for a national AARP grant. We didn't get the grant because there were thousands of people that went for a very small amount of money. But as we got into the research and need for such a program for the community, it was very obvious that there was a lot of loneliness in our seniors. There was a lot of stress for everybody and a lot of anxiety. And so the need was there. So we set it up as a public-private partnership funded by the Jennian Foundation from the private side and a group of people. And one of the things that Bethany and Marcy didn't mention is that they've been heavily involved and in fact are the anchor 30 minutes of a 6-program series that will start this coming Friday on Channel 79 and a dedicated YouTube channel. And their subject is happiness in today's normal, as you probably know from the email, and have done terrific yeoman's work in helping guide the program all the way through. Because of the nature of this program, Silver Hill is heavily involved. Mia Handler, the head psychiatrist at Silver Hill, is the moderator of all 6 programs. And she and Molly Norton, who's an outreach person and a practitioner clinician from Silver Hill, are doing the first program, which would be the one that starts coming up on stress and anxiety management. The one thing that I'll just throw out quickly is that when people were keeping track of anxiety management pre-COVID, 18% of the population was showing some form of anxiety. Our supposition for the moment is the number is 100%. There is nobody that could not be impacted by the COVID economically, health-wise, or otherwise. So dealing with stress and anxiety is a major issue, and they kind of lead themselves, and Mia and Molly will end their presentation by talking about how stress and anxiety lead to loneliness and how loneliness can deal with lots of problems. So without going on too much further, we've made a lot of progress and are ready to go on air. We need help in terms of the PR side of this. We've contacted the normal candidates of the Advertiser and the New Canaanite, but generally speaking, we have a list of people that we had to wait until yesterday. The only glitch in the whole thing was that we couldn't get a YouTube channel. There's so many schools and other people, because of COVID, competing for YouTube channels. It took over a month to finally get something that usually took a couple of days, but we have it. So we're ready to roll. Can use your help in any ideas you have for who we should be sending emails and announcements to. The one thing, Alyssa, is that I am supposed to put together a 300-word PR release for Channel 79. If you want to help me write that, I'd be happy to welcome you into the PR committee of the Telemental. And the last thing I'll leave you with for the new folks, although Telemental is the working name from the get-go of this thing, in point of fact, we are generally focused heavily on mental stress and anxiety and all the other pieces that go with surviving COVID. But the fact is that the mind and the connected body and mind is there intentionally. If you stop moving and stop thinking, the body and mind are indeed connected, and you begin to unwind and set up risks that are way beyond the normal COVID if you're not aware of it. So our job, education, get people engaged and talking and thinking. And again, we've got a terrific faculty, as it were, anchored by our own Bethany and Marcy. So stay tuned. Questions?
Jim, question, Jim.
Yep.
Along with talking about anxiety, etc., do we have a list of counselors? We have a list in New Canaan, I believe, of counselors available. I mean, it's okay to talk about it, but ask for help. And are we giving them a list of counselors that they could call? I'm just question.
There is a list. That is available. I'm not sure right now how I would answer your question specifically because it's not part of the program as it's constructed, but I will make sure it is covered because it's a wonderful idea. Needless to say, with professional psychiatrists leading the presentations, one of the things they recommend is seek help big time. And,
ask for help.
So, and most people in New Canaan, one of the things, I'm trying to think how to make this a short story, but one of the things is people in New Canaan and this program is for all adults, but specifically for seniors. They don't like to be told there's anything psychologically that the seniors or any adult citizen of New Canaan can't handle. So they want to talk about mental, let alone psychiatry and stuff like that. So we've been very careful to try to focus it on well-being, which is the combination of the body and mind and body. But at the end of the day, getting professional help is for those that need it available, and we will make sure that that is communicated. Thank you.
Okay.
Jim, I like the way you've eliminated the word telemental from public marketing, and the mind and body theme is really good. So kudos to whoever came up with that idea. So
I'll take it.
And Jim, you've done an amazing job. The time you've spent, we love seeing you here at Human Services, and you've just done an unbelievable job, and
Oh,
you're passionate about this, and it shows. So,
well, I want to comment on that because Bethany and Marcy had a lot of concern that they would not be professional enough. So we went through their presentation with PowerPoints and whatnot. And then Bob Doran, who's the director, said, let's just talk about the things you do on a daily basis that are the basically takeoffs of things that we just finished talking about for the last hour. When they did that, you guys on the commission will be very proud of what our committee or our department does in terms of how they talk to themselves as well as to the customers and the clients of our citizens. So you're going to like it. You'll have to wait until probably early to mid-November before you see them on air, but they did a terrific job, and we're very proud of that. So thank you. And part of what we did this for also was to publicize what the Commission of Health and Human Service does, why it is important to the town, and most importantly then to feature our staff as to how and why they are in the business that they're in, but very professional. Thank you.
thank you.
Jim, it's amazing what you've done with this, and with primarily, but also support of Bethany and Marcy. In terms of publicity, I think, so we have the advertiser, the New Canaanite, the 400 members of the New Canaan Men's Club, plus Bethany, about 2,300 mails to all the seniors. So I think we've pretty much got it covered in terms of publicity. Now, when this thing mushrooms beyond the confines of New Canaan, that may be another story, and it may have its own life after that, but we'll see. And it's a week from this Friday when it starts.
Yeah, I'll just add one quick thing. Because this is a community activity, again, besides the normal folks like the advertiser and the Canaanite, and there are lots of other lists, such as the Chamber, the Men's Club will give us a role on their 400 members, YMCA, library, lots of people involved, including the New Canaan Foundation, who's very active in helping the town deal with COVID. So we don't need their money, but we do need their contact and support. So that's one of the calls I'm making right after this meeting.
Jim, are we going to be showing this at some frequency on channel 79? That would seem like a
It'll be a 3 times a day standard. This is, in fact, we're the part of the lead idea of the reorganization of channel 79 to provide content. And if Kevin's still on, it's beyond just showing meetings of the planning and zoning and the selectmen and whatnot, but to try to have higher content stuff. So one of the other things, if any of you have not seen it, you should check out. It's on right now. The women, the feature on women, which features our own Bethany as the lead act, as it were, in that. So Bethany's going to be a big star for us in the the media for the next 3 or 4 months. But anyway, the net of it is to provide an ongoing content of things of interest to the community, such as mental health and women and et cetera, et cetera. So it's going to be a little bit different. And I know Bob Doran is taking over the management, and one of the things will be that they will publish and present an ongoing communication to the town of when there are programs and what the schedule is. But the other thing is that's why we're also going online, which will be available. The program will be our programs and all of the new things under Bob's leadership with this idea of community communication over and above meetings. Basically, will go online so you can access it anytime.
Also, in terms of referrals, all of these speakers, they're their own referral source, and either themselves or they can distribute it, like Mia Handler from Silver Hill, et cetera. John Hamilton with alcohol, substance abuse, marital issues, et cetera. So these are all sources, but I know Jackie has a list of therapists in town. I imagine Bethany and Marcy do also. So we will have enough referral sources for the observant population.
Yeah, great. Yeah, the whole purpose of this is to be the catalyst to the community to say, you know, here's how you deal with this. Here's some tips. Here's the resources. And if you're lonely, it's your own fault, as it were. So lots of people are going to jump in and help, but this is just one of the many pieces. Thank you.
Thank you. Lastly, new business, holiday programs. Bethany, you're back on.
So we, working with COVID this year, the seniors, we are going to do Christmas bags, just like with a little scarf and a crossword puzzle or word search and Kleenex and just some kind things that they can gently, take out when they would like. And so National Charity League is going to be helping us with that. And also we will just order a little tin of cookies. So we can, I think we're going to have a lot more deliveries this year. I would like to do that with the commission if possible. It's just a contact-free, leave at the door delivery. And Marcy and I are going to work on that. The families, instead of gifts and people coming in and out and donating, we are going to do a $50 gift card to each person, to each child. The clothing, the jackets and the mittens and the socks that get donated so generously every year, we are going to have that at the food pantry. What we're trying to do is limit the amount of traffic going in and out of human services. And so we will have that at the food pantry, and those are the families that receive these that receive the help during the year. So we're going to be doing two things at once there. And then for the food pantry, we are going to give out the gift cards for Acme for Thanksgiving and for the holidays in December. The Dove boxes, the woman who usually does all the bags of food through Person to Person in New Canaan Country School, we get hundreds of bags. And so she no longer lives here. She lives in Florida, and she said, she could help. But what we decided, let me know if you're wrong. Let me know if there's a different opinion. They always give a $25 gift card with these huge bags of food. So we said to eliminate the bags of food, but if they could still continue the gift card, that would be wonderful. So I haven't heard back from her, but we are just trying to keep gift cards. I have a director's meeting of small towns every 2 weeks, and Reading, Weston, Darien, Westport, everybody is doing it this way. They're only doing gift cards. They are not doing any type of holiday gifts at all, just because of the transmission and the traffic going in and out of human services. So that's what we have in a nutshell. If anybody has any other ideas, we're just trying to keep it
How we
simple.
set a priority? Is this going out to the vulnerable population, the 120, or who's exactly, like the Christmas bags? Help me understand who exactly are we
These will be
delivering?
for the homebound and those that have been very fearful of going out during COVID. We do have our list. Some of them would not want to receive the bag and cookies. They're a little too independent for that. They don't want that, but we are going to go through the list to see how many we have that we can respectfully give these thoughts to. And
Well, I'm wondering if we can put like, to gym listers, to the mind body, if we can put something in there, even if it's just a card that they can think about or access, or as a reminder to a website or something of that nature. And if there's any other program support that we can provide, we're happy to put that together with Jim and whoever else to insert it in there in case they don't want to eat the cookies, but just as a reminder that here are
A great idea.
you can access.
That's a great idea. That's a great idea. And the cookies, we'll just do like 6 cookies. Walter Stewart's will make them up and tie it, so they know that it is store, it's all, very safe, contactless cookies. But that's a great idea, Russ, is to put
Yeah.
a card in there. Great idea.
Yeah.
I hate to mention this, but are the cookies hypoallergenic, or we keep the nuts out, et cetera?
Good question.
Sorry.
I'll see what Walter Stewart's does.
Yeah, and I mean, we've distributed those or candies, right, Jim, in the past when we do the Christmas visitation. The one thing about the poinsettias, I know you've eliminated them, I think, but at least they were decorative, even though some of them didn't look so healthy when we brought them to the houses. At least it's festive and in season. The scarves, replacing them, I don't know.
I don't, with the, just the, the
A
poinsettias are-
plant that has some color and what have you.
to see, we could possibly, but then, okay, they're outside. Well, yeah, let's talk about it. It's, they're very, very expensive, but maybe we can come up with some, that we'll work on it more. Good input.
Okay.
Right.
Okay.
Sounds good. I think that's it. Our next meeting, which will be Zoom again, November 5th. Thank you all for attending. And again, welcome Jen and Alyssa. And it was a very good meeting. I think you learned a lot about what we're about. And so that's it. May I have a motion to adjourn? Enjoy this nice New England weekend.
Motion
So
to
moved.
adjourn.
Second.
All those in favor?
Okay.
Done. Thank you.
Welcome,
Bye-bye.
everyone.
Thank
Thank you.
you.